Hey, what's up, guys? It's me, ThePsychNPDavidC. Have you ever walked into a clinic or a hospital and then instead of seeing a doctor, you see someone else with the letters NP after their name? A lot of people ask me, what exactly is a nurse practitioner? Are you a doctor? Are you a nurse? Are you somewhere in between? And I don't blame them because when I was a nurse, I actually didn't even know what nurse practitioners did either. So today I'm going to break down what nurse practitioners actually do, how we're different from doctors or nurses, and why you might see more of us in healthcare. Let's talk about it. So first things first, I live in California, so I'm going to be explaining things from a California standpoint. So things may be different in other states. So what is a nurse practitioner? A nurse practitioner, or NP for short, is an advanced practice registered nurse. Sometimes they're referred to as APRNs. So that means we have a graduate level education, either a master's or a doctorate in nursing. We're trained to assess, diagnose, and treat medical and mental health conditions. We can prescribe medications, and we either see patients independently or alongside physicians. So in short, we're licensed clinicians who can manage your care. So let's compare nurse practitioner, or NP, versus registered nurse, or RN, versus doctor of medicine, or MD. So first, let's start with registered nurse, or RN. In order to become an RN, you need either an associate's or a bachelor's degree. Their main focus is usually bedside care and patient monitoring. They cannot prescribe, and they must work under a physician. Now let's compare that to nurse practitioner, or NP. In order to become an NP, you need a master's or doctorate level education. Their main focus is assessment, diagnosis, and treatment. They are able to prescribe medications, and depending on the state, they can either work independently or under the supervision of a physician. And last but not least, we have doctors, or MDs. In order to become a doctor, you need to attend a medical school and complete a residency. Their main focus is diagnosis, treatment, and sometimes even surgery. And obviously, they can prescribe medications. And they can work fully independently and autonomously. So you can kind of think of nurse practitioners as like a middle ground between RNs and MDs. We can do most of the things that doctors do, but not all of them. Now let's get into the different specialties of nurse practitioners. Nurse practitioners can specialize in different areas just like doctors can. Some of the most common NP specialties are family practice, or FNP. This is similar to like the doctor you go to for a routine visit. And then you have pediatric NPs, or PNPs. Obviously, they specialize in babies, infants, adolescents, teenagers. And then you have adult gerontology NP, or AGNP. They specialize in helping the geriatric and elderly population. And then you have acute care NP, or ACNP. They specialize in treating acute or complex medical conditions. There's also Women's Health NP, or WHNP. That's pretty self-explanatory. And then we have my personal favorite, Psychiatric Mental Health Nurse Practitioner, or PMHNP. They treat mental health conditions like depression, anxiety, ADHD, and things like that. So depending on their specialty, an NP might be doing anything from like delivering babies to treating depression and anxiety. Now let's get into their scope of practice and why it varies by state. This is where it gets a little bit more complicated. What an NP can do depends a lot on the state that they're in. So there's three main categories. The first one being full practice. These NPs can diagnose, prescribe, and treat independently. And then the second category is reduced practice. These NPs need a collaborative agreement with the physician. So as of right now, this is actually how it works in California. I have a collaborating physician that I see maybe once a month. We'll discuss things like complex patient cases, any new treatment guidelines, and generally just check up on how everything's going. The physician doesn't have to be on site where the NP is working, but they must be available to reach by like phone or email. And then the third category is restricted practice. Now these NPs must work under physician supervision. So the scope of practice of nurse practitioners varies a lot by state. Now I'll just describe to you what a typical day looks like for me. For me, I'm a telehealth mental health nurse practitioner. So a typical day for me is probably a lot different than another NP. In the morning, I'll review patient charts, review any lab results that just came in. Sometimes I'll have messages from the office or from patients. In general, I just prep for my appointments that day. Then when it's time for an appointment with the patient, I log into the secure video link, and then I'll assess their symptoms, make any medication adjustments as needed, provide education, and sometimes I do therapy as well. If a patient is doing very well and they're stable, the appointment can be as short as like 2 minutes. But for a patient who's more complex and unstable, the appointment might even take up to an hour. And then in between these video calls with patients, I'm finishing up my documentation. Now, while all this is happening, sometimes I get like fax requests from pharmacies, or a patient calls the office that says they are unable to pick up the medication. So there's a lot of those little things that add up. There's also some patients who request disability forms to be filled out, or like leave of absence or school excuse forms. So I'm doing those as well. So the time I stop working each day actually varies a lot. As I mentioned, this is just a day for a telehealth psychiatric nurse practitioner. So a typical day for other NPs will be a lot different. Now let's address some common myths that I hear about nurse practitioners. One I hear a lot is, you're not a real provider. And my response to that is, we're licensed and board certified to treat and diagnose. Another misconception I hear is, you just follow a doctor's orders. For the most part, that's not true. In a lot of states, NPs can practice independently. And in states like California, where you have a collaborative agreement with the physician, a lot of the time we make our own orders without consulting the physician if the case isn't very complex. Another misconception I hear all the time is that nurse practitioners are just training until they can become a doctor. So that is definitely not true. Being an NP is its own separate career, so it's not like a stepping stone towards becoming a doctor. In a sense, once you become an NP, there's no really going further up in education. Now let's discuss how to become a nurse practitioner. So the usual path is to get your RN license first, with either an associate's or a bachelor's degree, and then you start working as a nurse for a little while to gain experience. And then they complete a master's or doctoral NP program. A lot of RNs do this while they're working as an RN, and then once they finish the NP program, they have to pass the board certification exam. And after that, you just apply for your state license. So for me personally, I started with just my associate's degree as an RN, and then I went back to school and got my bachelor's degree in nursing while I was working as a nurse. And then I also completed my Psych NP program while I was working. So it took me 2 years for my associates, 2 years for my bachelor's, and 2 years for my NP. So it took me 6 years in total, but you can do it quicker than that if you take like accelerated programs. So yeah, basically you have to start as a registered nurse first, and then you work your way up to becoming a nurse practitioner. Now let's discuss why NPs are valuable in healthcare. Right now, NPs are one of the fastest growing roles in healthcare. That's because there's a shortage of physicians in many areas. NPs increase access to care, especially in rural areas. We often spend more time with patients on education and follow-up, especially since we started out as nurses. And studies show NP outcomes are comparable to physician outcomes in many different areas. So nurse practitioners aren't here to replace anyone. We're here to expand access to healthcare and work as part of the team. So to summarize, nurse practitioners can do a lot of things that physicians do, including assessing, diagnosing, and prescribing. But what they can do varies a lot by state. Hopefully this video gave you a better understanding of what nurse practitioners actually do. If you found this video helpful, make sure to like and subscribe. I'm also on TikTok and Instagram as well if you want to follow me over there at ThePsychNPDavidC. I do telehealth medication management for adults living in California. If you're interested, there's links down below. And with that, your mental health just bubbled up. You're welcome.